Hello everyone, my name is Tuv, and today's video is the Botched Surgeries Iceberg. Hello everyone, and welcome back to the Tuv channel. Today's upload is the last week of the November events. As I'm recording this, it is October 10th, so you are seeing a past version of me, and I really hope this event goes well. I hope you guys have been enjoying the videos. I hope a lot of old viewers that haven't watched me in a long time have returned. I hope the videos have done extremely well. I don't know, but here's to high hopes, right? But something I do want to add to the end of this video is going to be the November version of me, the most recent version of me talking about how the event has gone. So if that sounds interesting to you, then stay until the end. But as I was saying in the intro, today we're going to be talking about the Botched Surgeries Iceberg. So this video is mainly focusing on cosmetic surgeries that went wrong. So no, we're not going to be talking about potentially life-saving surgeries, such as like heart or brain surgeries. We're not talking about that. We're talking strictly cosmetic surgeries where the person in question was horribly disfigured. Now, since this is an iceberg video, we are going from most tame to most gruesome. So the longer you keep watching the video, the more and more horrifying these cases will get. If that sounds good with you, don't subscribe yet. I will earn your subscription by the end of this video, and let's get right into the topic. The tip of the iceberg. Cardi B leaked for 5 days. Now, I told you we're going to start off on a somewhat tame level, but even this one is kind of gross. And we're starting it off with none other than Cardi B's BBL. See, her story is rather interesting. So back in 2014, Cardi was 21 working as a stripper, and she had this boyfriend who cheated on her with someone who, in her words, had a fat big ass. At the time, from her experience, she also began noticing that her coworkers with bigger butts were making more money. And this was disregarding whether or not they could actually dance. Also, I know this is a little bit random, but I don't really wear these glasses on the main channel over here, so if you see the light reflecting whenever I look at the camera, I'm aware of it. Maybe you won't see my pupils sometimes, but I'm not going to be talking like this, so there's no reflection. Not the point. Let's keep going with the story. But Cardi didn't have enough body fat for traditional liposuction, so she went with another less ideal option, illegal filler injections. This was someone with no medical license or any of the fancy operations like a sterile environment. This was just some random lady with a needle and whatever synthetic material she was using, probably silicone or hydrogel, neither of which are FDA approved for this. Under those conditions, it won't surprise you to hear that they didn't use any kind of sedative. She told GQ that it was the craziest pain ever, saying she felt like she was gonna pass out, felt dizzy. It sounds awful, but we haven't even gotten to the worst part yet. After the procedure, her butt started leaking. For 5 days straight, the injection just kept leaking fluid because the needles used were so large that they left massive holes in her skin. Imagine walking around for almost a week with your butt injections literally dripping out. So why did it happen? Well, according to real doctors, and like I said, these illegal injections use huge needles that cause the material to seep out for days from the puncture wounds. And the craziest part is, even after all that, she was actually planning to go back for a touch-up because she wanted her butt even bigger. But by the time she scheduled her second appointment, which I don't know why you would go back, but by the time she did that, the woman who did her injections actually was already locked up, because allegedly someone had died on her table. The FDA even issued warnings about this stuff. Injecting liquid silicone into your body can cause scarring, infections, and yeah, death. You could have the material accidentally injected into a blood vessel, which could kill you instantly. But Cardi got lucky, sort of. She survived. The results apparently turned out okay, and she went on to become a global superstar. No lawsuit here as well, because you can't exactly sue someone for an illegal procedure you willingly got in a basement. Patient CH couldn't shut mouth after surgery. It's not uncommon for parents to want to remove birthmarks from their kids, and that statement gets especially true when they're told that that birthmark has a small risk of cancer. So back in January of 2008, William and Brandy Hoffman brought their 4-year-old child, known in court records only as CH, to see Dr. John T. Lindsay, a plastic surgeon in Metairie, Louisiana. The kid had a nevus sebaceous, basically a yellowish birthmark made of overgrown oil glands, and it was sitting on the chin and neck. These birthmarks don't just go away on their own. And there's this whole debate in the medical community about when it's the correct time to remove them. And the Hoffmans decided their son would have it removed at the age of 4. Dr. Lindsay performed the surgical excision on January 30th, 2008 at the Huma Outpatient Surgery Center. Should have been straightforward, but what happened after? Well, that's where everything went wrong. The surgery site didn't heal normally. Instead, CH developed hypertrophic scarring and keloid formation. It means that the body went into overdrive producing thick, raised scar tissue. Now, when you're dealing with scars on the face and neck, especially on a 4-year-old, this can cause serious problems. The skin contracted, pulling down CH's lower lip so severely that it couldn't close properly. Couldn't even be in contact with the upper lip anymore. The medical term for this is incomplete lip competence, which is a fancy way of saying that the kid literally couldn't shut their mouth all the way. And it wasn't just the lip, the scarring also caused something called skin tethering on the midline of the neck, which limited how much the child could extend their neck. So basically, all that to say that an innocent kid who went in for a birthmark removal came out unable to close their mouth properly, unable to eat normally or speak clearly, and had to deal with constant drooling. And that neck movement restriction proved to be very uncomfortable. You know, average everyday things like turning your head. He couldn't do that without being in chronic pain. The Hoffmans weren't having it. In 2011, they filed a federal lawsuit seeking over $750,000 in damages against both Dr. Lindsay and the Surgery Center, claiming medical malpractice, negligence, failure to provide appropriate care, insufficient training or experience, and even failure to adequately explain the potential risk before the surgery. Dr. Lindsay's defense was that this was just bad luck. Through his attorney, he argued that CH developed, quote, unpredictable abnormal pattern of healing that wasn't caused by negligent surgery. He even had 3 board-certified plastic surgeons review the case, and they all said there was nothing he could have done to prevent the scarring. This was apparently just healing gone very, very wrong. And all that for a birthmark that statistically has a less than 1% chance of ever becoming cancerous in the first place. Penny Johnson, permanent facial palsy and twitching. See this woman smiling in this photo, or at least trying to. You might see her and think she's making a face, or maybe got caught by the camera at an awkward angle, but no, that expression is in fact permanent, and it twitches constantly. Her name is Penny Johnson, a 49-year-old British businesswoman who walked into a cosmetic surgeon's office in 2003 wanting to fix some dark circles under her eyes and maybe reshape her nose. But Dr. Ruiz, I probably butchered that name, but here's the text version of it. A cosmetic surgeon in Leeds had other ideas. He talked her into going bigger, a full facelift plus replacing her breast implants while they were at it. That decision would completely destroy her life. After the surgery in August of 2003, Penny developed palsy on the right side of her face. It was nerve damage. Dr. Fury attempted surgical revisions to fix it, but instead of getting better, they got progressively worse. The right side of her face started twitching uncontrollably. She had developed a permanent grimace that she couldn't stop, in addition to not being able to fully close her right eye anymore. As she told the court, her face was constantly contracting. She said she wasn't able to sleep, and that there was this permanent buzzing around her eye, sometimes so intense it stopped her from even thinking about anything else. And with all that going on, her whole life fell apart. She no longer felt like the confident, successful businesswoman who had co-ran a consulting firm with her husband. In 2007, Penny sued Dr. Forey, and he admitted negligence. His defense team just argued she was asking for too much money. Penny initially sought 54 million euros, claiming that was her potential loss as a 50% shareholder when the company failed. In 2011, justice awarded Penny 6.1 million euros, that's over 10 million USD, and much more in today's money. The bulk went to lost earnings, both past and future. The judge also awarded 80,000 euros, specifically for the facial disfigurement, breast surgery complications, and psychological damage because he noted that Penny had developed, quote, a prolonged adjustment disorder with features of anxiety and depression from the botched procedures. Amy could not open her eye for 16 weeks. We're still at the tip of the iceberg here, and already things are getting unsettling, and I promise that by the end of this video, you're gonna have a lot of whys. Anyway, next is the story of Amy, a 36-year-old woman from Northumberland, UK. She saw an ad on social media back in December of 2022, and what happened very much leans on the unsettling side of things. The ad was from what claimed to be a, quote, clinic offering Botox injections. I mean, professional sounding and all, right? The post even specifically used the words nurse and clinic, so Amy figured she was dealing with a qualified professional. Wrong assumption, because when she arrived, it wasn't a clinic. It was actually just someone's house. Just a residential property with a poorly lit living room where this woman was apparently running her, quote, business. Now, at this point, most people probably would have just walked right out, and Amy actually admits that she regrets that she didn't do that. But she had already made the trip and the price was already discounted, so she went through with it. Big mistake. The procedure itself felt wrong from the start. How so? Well, Amy had been told by someone else that Botox injections should feel, quote, like a little bee sting. But this was actually very painful. She could feel the needle twisting under her skin, and when it was being pulled out, it pinged and scratched against the surface. Not exactly the professional experience you would expect from a licensed practitioner. Within a couple of days, Amy noticed her eye starting to droop. 5 days after the injection, she couldn't move her eyelid at all. Her eye was completely stuck closed for 16 weeks. I mean, that's not exactly what you would call a common reaction to any medical procedure. Actually, while researching this story, we found out that what happened here is actually named eyelid ptosis, and it occurs when Botox migrates from the injection site to the levator palpebrae superioris muscle, the muscle responsible for lifting your upper eyelid. When that muscle gets paralyzed, your eyelid just drops and doesn't get back up. Well, that is until the Botox wears off, which could be anywhere from 3 to 6 weeks. But in Amy's case, it took more than that. More than double the typical duration, which suggests either a massive overdose or the Botox being injected in the completely wrong location. Desperate to fix it, Amy sought help from a different cosmetic practitioner who described eye drops designed to tighten the muscles around the eye and help open it. But even with treatment, she had to wait the full 16 weeks for the initial dose to wear off naturally. While waiting for the horror to end and her eye to finally return to normal, Amy tried to get some basic info from the woman who did this to her, like the Botox batch number, who prescribed it, and where she had trained. But as you'd probably guess, she couldn't get any of it. That's when it also finally came to her that this wasn't a nurse at all. She was just a random person with a needle working out of their living room. Pretty unsettling when you think about it. The surface. Andrea's filler. Kicking us off on the surface level is the case of Andrea. Just take a look at this. On the left, that's Andrea before, and on the right, that's Andrea 2 years after getting fillers. She's 60 years old, by the way, and now she covers her face with a mask whenever she leaves the house because she worries people will laugh at her. Just minutes ago, we talked about one woman trusting a discount social media ad and ending up with a closed eye for 4 months. Well, Andrea did the complete opposite. She did, quote, all the right things to check the clinic's reputation before booking her appointment, and she still ended up disfigured. So even doing your homework sometimes doesn't guarantee you'll be safe. Well, at least not in the seemingly unregulated kind of wild west of UK cosmetic procedures. Here's basically what happened. In December of 2021, Andrea visited the Reshape U Cosmetics clinic in Hull for breast fillers. The clinic's website claimed it had, quote, won Best Aesthetics Clinic in Yorkshire in 2022 at the England Business Awards. Their social media pages showed a man named Sean Scott with Doctor in front of his name, Dr. Sean Scott, Clinical Director. There was even a plaque on his office door that said Dr. Sean Scott, PhD, Clinical Director. So it looked like everything checked out. That was until a BBC investigation discovered that Sean Scott wasn't in fact medically trained at all. He was a tattoo artist for 33 years before opening Reshape U in 2019. That PhD title was, and I quote, naively and regretfully bought as an honorary doctorate in business consultancy online and displayed the certificate in his clinic. It's basically like ordering a poster off eBay. After Andrea's first breast filler procedure, Scott gave her antibiotics. 2 months later, Scott told Andrea he thought her cheeks were, quote, uneven and he could help harmonize her face. Sounds pretty evil to me, but whatever, let's just keep going with the story. So she agreed to facial fillers in her cheeks, chin, and jaw. That's when everything went catastrophically wrong. Her face started swelling and dark marks appeared. But instead of stopping the procedures, Scott allegedly told her the swellings were caused by an insect bite and encouraged her to come back for more treatments. Yes, Doctor of the Year, everyone. Definitely not saying and doing things for the money and putting people's lives in danger. Seems like a great guy. Over 10 months, can you guess how many times Andrea went to that doctor? Maybe 1 time? Well, no, you're watching a Tub video. Maybe 5 times? That's already a lot. To get fillers and Botox? No. Maybe 10 times? No. Maybe 20 times? No. It was 30 times in 10 months that she was getting procedures. She even sold jewelry and borrowed money for it all. And her face just kept getting worse and worse. By October of 2022, she went to the hospital barely able to open her eyes. Plastic surgeons later confirmed her reactions were caused by the cosmetic procedures. A cosmetics expert added that her scarring was likely from an infection, rare if proper techniques in a clean environment are used. And because of a fake doctor, she now has to live like this. Quote, I see a gargoyle, she told the BBC. Erin Schaefer. Fluid began to pour out of her stomach and hit the floor. Next case, Erin Schaefer, a 37-year-old training manager for UPS, had successfully lost 100 pounds and wanted to get rid of the excess skin. So in January of 2024, she went to Sono Bello, a national cosmetic surgery chain that advertises itself as America's top cosmetic surgery specialist. She had liposuction and was satisfied with the results. 2 months later, she decided to go back for more. On the morning of March 29th, Erin showed up for more liposuction, plus a mini tummy tuck that Sono Bello brands as AbX. They handed her some Xanax and oxycodone pills, then during the actual procedure, pumped lidocaine into her to numb things while keeping her conscious the entire time. Sono Bello sells this local anesthesia method as the safer option, promising quick recovery with barely any discomfort. Supposedly, you can be back at work within a week. But since she made it onto this list, that's obviously not what happened. Erin says the pain got so intense during the operation that she started crying and desperately asked the doctor to stop before it was even completed. She describes it as feeling like her skin was being stripped off her body alive. 48 hours later, her temperature spiked. The next day, her pubic region puffed up with serious swelling. She reached out to Sono Bello staff and they brushed it off, assuring her everything was fine and totally normal. 2 days after that, she woke up and stood from her bed, and blood and fluid started pouring out of her abdomen. When she went back to the office, the surgeon who had operated on her, Dr. Manuel Herrera, who's board certified in obstetrics and gynecology, told Erin she needed immediate hospital surgery to fix her wounds, though he wouldn't be able to do it himself. Why? Well, because his specialty was in delivering babies, not plastic surgery. Yes, biggest plot twist you'll ever see. I don't know why he did that procedure on her if that wasn't what he studied for. Money is the answer. It's probably gonna be money. His credentials only worked at hospitals in Orlando, roughly 140 miles southwest. That came as a shocker, and understandably, Erin was completely stunned. She ended up being hospitalized for a week in Florida, fighting off a dangerous infection. More than a year down the line, she's still living with scars across her lower body. Now, she and her husband are taking legal action against both Sono Bello and Herrera. And surprisingly, their story doesn't end there. A major investigation by KFF Health News, working with NBC News, uncovered that Sono Bello and similar cosmetic surgery chains have faced dozens and dozens of medical malpractice and negligence lawsuits over alleged disfiguring injuries, including a dozen wrongful death cases just in the last 7 years. Sono Bello by itself has fought off over 60 malpractice lawsuits since April of 2013, with 4 of those involving patients who died. And despite all this mess, Dr. Herrera is viewed as a star on the rise. In 2023, his performance earned him Sono Bello's annual New Talent Award, recognizing outstanding technical ability, high productivity, and extreme brand loyalty. He's still on staff. Carol Bryan, quote, looked like an alien. So we're still at the surface of the iceberg, and these images are not only getting harder to comprehend, but also, with all due respect, the images are getting harder and harder to look at. So picture yourself doing everything right. You weren't chasing discount procedures or trusting fake doctors. What if you actually worked in the beauty industry and knew the ins and outs and still ended up, quote, looking like an alien? Well, that's Carol Bryan's story for you. Carol was a fashion model, one that you would generally consider beautiful, successful, and confident. She had been getting Botox since her late 30s, just for the lines between her eyes, and was thrilled with how subtle and effective it had been. Then in 2009, when she was 47, doctors told her at her age she should try something new, fillers that would replace volume loss in her forehead and cheekbones. She trusted them. After all, she knew this industry. But luck wasn't on her side though. During the procedure, 2 different fillers, one of which was permanent silicone, mixed together with the same syringe and injected into areas of her face where they should have never been used. At first, she had the typical side effects, bruising and some swelling. But 3 months later, Carol looked in the mirror and she didn't recognize herself anymore. This is what she saw. Her face had started expanding and contracting. The stuff in her face had hardened and was basically pulling her skin, leaving her features all messed up. Her forehead became so swollen and heavy that it almost collapsed over her eyes. She couldn't see unless she physically taped her eyelids open or held her forehead up with her hands. So, panicked, Carol went back for corrective procedures and they made everything worse. She became, in her words, grossly disfigured. So disfigured that she couldn't leave her house, and worse still, she stopped looking in mirrors and hid not just from the brutal online world, but from her own family and friends. Finally, in 2013, her daughter had enough. She and Carol's sister begged hospitals across the US for help. Every single one said no. Her case was too crazy, too risky, except one, Dr. Riza Jarahi at UCLA. What followed was 7 surgeries, including a 16-hour operation where they sort of, not literally, stripped her face and transplanted skin and tissue from her back. And they had never done anything like it before because of the filler still in her face, and they weren't sure if the blood vessels would even survive. She made it through, but at a cost. Carol was left permanently blind in her right eye. The original injections had already damaged her optic nerve, and the new surgeries just couldn't fix that. The body. Gao Liu, nose turned black and, quote, died. Starting us off at this level is the case of Liu, which is not as horrific as it is strange, and I mean that. What you're about to see is a weird kind of disfigurement. Gao Liu was a rising star in China, a singer and actress who'd been dreaming of fame since she was 5 years old, growing up with the belief that an actor had to look flawless from every camera angle. She had appeared in multiple films and TV shows, building a name for herself, gaining traction. She had 5 million followers on Sino Weibo, China's version of Twitter. In October of 2020, a friend told her that her face was perfect except for her nose. Now, if I had to throw my 2 cents in there, sounds like a shitty friend. I don't know what type of people you guys surround yourself with, but please don't hang around someone that tells you, hey, you're beautiful except for your blank. Like, I don't know, man, just doesn't seem like a good friend to me. Anyway, let's keep going with the story. That friend had recently gotten rhinoplasty done and looked, quote, amazing, so she recommended Gao visit the same clinic, Guangzhou, a popular spot with influencers. Gao figured, why not? Just a slight trim. Something to help boost her career. The procedure lasted 4 hours, and because beauty was the end goal here, Gao thought those 4 hours would make her more beautiful. It turned out to be the beginning of a nightmare. According to Dr. Jonathan Zelkin's analysis, the surgeons took cartilage from her ear and transplanted it to her nose tip to make it bigger and more defined. That's standard practice for Asian rhinoplasty. But something went wrong during the operation. Her nose appeared irritated while she was still on the table. When Gao woke up, her nose felt, quote, irritated and tingly. Then it got worse. Within days, it became infected. She had to undergo a second emergency procedure to remove something from inside her nose, either the implant or ear cartilage graft. Reports are not clear which, but that second surgery failed to stop what was happening. The tip of her nose started changing color. First it turned purple, then it turned darker and darker, until finally the tip of her nose just turned black. The tissue had died. The cells at the tip of her nose had literally stopped receiving blood flow and died while attached to her face. And what happened to the clinic and the surgeon? Well, an investigation by the Guangzhou Health Commission revealed that the surgeon did not have proper qualifications as a licensed plastic surgeon to perform unsupervised surgery. The doctor was banned from practicing for 6 months. Yes, you heard me right, 6 months. That's it. The clinic was fined $6,700, yes, insert a 6-7 joke right there, and given a warning. Meanwhile, this girl with a necrotic nose will have to wait at least a year before she can even think about reconstructive surgery thanks to how bad the damage got. Christy Alice lost both breasts. Elective cosmetic surgery is always tricky. You're making a conscious decision to go under the knife, trusting that the outcome will be better than what you started with. But what happens when you walk in with breasts and then walk out without them? So this is the case of Christy. In 2003, Christy Alice was 28 years old when she decided to have an elective cosmetic procedure done. She wanted a breast lift and augmentation. 2 distinct but related procedures that Dr. Luciano Bomi, a Naples plastic surgeon, suggested performing together to achieve her goals. She signed consent forms for both procedures and showed up on April 16th at the Bonita Bay Surgical Center in Bonita Springs, Florida. But what was supposed to be a routine cosmetic surgery, something that had been done countless times on thousands of women before, ended up turning into a complete disaster for everyone in that room. During the surgery, the blood supply to Christy's breast was cut off. And remember, without blood flow, the tissue dies. So that's exactly what started happening. Her breasts turned black and formed hard, dry tissue, the same kind of necrosis we saw with Gao Liu's nose, except this was both breasts. Christy remained under Dr. Bomi's postoperative care for approximately 6 weeks, but the damage was catastrophic. On June 2, 2003, she consulted another plastic surgeon, Dr. Robert Bruick of Fort Myers, desperately trying to salvage what was left. He performed multiple procedures attempting to close the wounds and reshape some of the remaining tissue, but it just didn't work. Over the course of all of this, she went through 13 more surgeries trying to fix the damage, and in the end, despite everything, despite all those surgeries, all that pain, all that hope, she lost both breasts entirely. The case went to trial and Christy was awarded $8.2 million in August of 2006. A tidy sum, but probably not enough if you remember she sadly no longer has breasts. Crystal touch. Permanent blindness on one eye. This next case shows you just how quickly things can go wrong. We're talking literally minutes. The short time it takes to inject filler into your nose and your life changes forever. Crystal Touch walked into a VIP plastic surgery in Henderson, Nevada on December 2nd of 2021 wanting something simple, a non-surgical rhinoplasty using Restylane, a hyaluronic acid filler. The goal was to build up her bridge and lift her tip, what the industry calls a Tinkerbell lift. Quick procedure, minimal downtime, and walk out looking better. Well, that's what she was promised. She had a 10 a.m. appointment, but the person who performed the procedure was a registered nurse named Diane Hamu, who advertised herself on Instagram as a quote, master aesthetic injector. However, as soon as she injected the tip of Crystal's nose, she felt the pain shoot up to her left eye. She started tearing up and squinting, telling Hamu she couldn't see and that it hurt. But Hamu kept going, ignoring and continuing the injections as the pain got worse. Crystal began crying and telling her to stop. Finally, Hamu left, What was going on exactly? Well, here's the medical explanation. See, veins running through your nose supply blood and oxygen to the eyes as well. When you inject filler into that area, if you hit one of those veins and block it, it's essentially like having a stroke in your eye. The filler that shot up to Crystal's left eye had cut off the blood supply. She could feel it dying in real time. Yes, it sounds terrible even explaining it. And that's how she was left permanently blind on that side. Of course, she sued. The nurse no longer works at VIP Plastic Surgery, but is still licensed and practicing at another cosmetic clinic in the Las Vegas Valley. Hey guys, sorry to interrupt the video. Actually, I'm not that sorry. It is Black Friday. The day that I release this, it is about to be Black Friday. But our Black Friday sale starts now. When you're watching this video on Wednesday, it starts now. So let me show you what we're selling. So if you head over here to our website, earldoesn'texist.com, you'll see some beautiful shirts. Actually, this one's already sold out. Yeah, you messed out. And this one's already sold out. So we do have this one and this one. That is my logo, and that is an old dentist picture. So these are, they say $35. For you guys, it'll be less than half. It'll be only $15. That is crazy. $15 for Exist. If you head over to the website, these should be 15 bucks. And we also have the Stop Loving Me signed vinyls. Again, these are the unupdated prices. This will be 10 bucks, bruh. We want to get these out. I want to start my new era with music. Let's get these out. The Exist Devil hats will also be $15. The Stop Loving Me signed cassettes will be $10. The SLM signed CDs will be $10. And also, if you're a fan of my music, you can actually go over to my Spotify account on either mobile or PC, scroll down, and then you see where it says merch. You can click any of them, and then you back out, and then it'll give you access to some shirts that aren't on the website, like some Stop Loving Me shirts that in fact did not sell out, and the Paul plushie keychain. These will also be at an extremely discounted price. So if you're interested in everything I just said, you can go to earldoesn'texist.com or go to my Spotify, it's named Tuv, and click the link there. And with that being said, thank you guys so much for supporting me. I appreciate it. Let's get back to the video. The Abyss. Raji Narain Singh, injected with cement, superglue, and tire sealant. The first one on this level is just insane. I mean, think of this. You pay a back alley quote professional, you expect to make you look beautiful, but instead they inject you with the same stuff that's used to fix flat tires? Where do you even start with this one? Well, anyway, that's exactly what happened to Raji Narain Singh back in 2005. The 48-year-old transgender woman from Miami went to a pumping party, basically underground cosmetic injection sessions where people in the trans community could get affordable procedures. She paid around $100 per session to someone who went by the Duchess, real name O'Neill Ron Morris, who claimed to be a plastic surgeon. She wasn't. Raji thought she could get medical-grade silicone injections in her face, breasts, and hips, but what Morris actually pumped into her body was a horrifying cocktail of cement, tire sealant, mineral oil, and superglue. Yes, superglue traces. You can't make this up. For months, Raji had no idea what was really in her body. She got about 10 injections in total from 2007 and 2010, but then her body started reacting. The substances hardened under her skin, forming golf ball-sized lumps on her cheeks, chin, and lips. The nodules were so massive and disfiguring that people started calling her Cement Face. She was terrified to leave her house. Meanwhile, Morris was still operating on multiple women across Florida, injecting them with the same toxic mixture. And in 2017, she was sentenced to 10 years in prison for manslaughter after 31-year-old Shatarka Nubi died from complications. Nubi had paid Morris $2,000 for treatments and suffered for 18 months while doctors tried to figure out what was injected into her body. The toxic material traveled through her bloodstream. Her end was death, and looking at it from the case of Nubi, Raji got really lucky. But this whole nightmare went on for more than a decade. She was too embarrassed to go to the authorities, although eventually in 2015, she appeared on that reality show Botched. First, surgeons Dr. Terry Dubrow and Dr. Paul Nassif turned her away. It was too risky, but they couldn't stop thinking about her case. So they brought her back in 2016 and performed 4 surgeries over 7 weeks to remove the toxic fillers from her face. And it worked. Although she still has nodules in her breasts and buttocks that are too dangerous to remove, most of the cement was taken out of her face. She looks a lot more normal now. Allison Hugh. Her private parts pulled open and flattened. Allison's case is really cruel because she did all the right things and she still lived in a nightmare. Full name Allison Hugh, her case goes back to 2002. At 38 years old and weighing 380 pounds, she underwent gastric bypass surgery. That's basically a procedure to help with weight loss. It worked beautifully and she lost 200 pounds, dropping her down to 185 pounds. But there was a problem. The massive weight loss left her with enormous amounts of excess skin on her arms, abdomen, and thighs. The skin chafed constantly, making it difficult to walk, and honestly, after all that work, she deserved to feel more comfortable in her body again. So she started consulting plastic surgeons about removing the excess skin from her thighs. But Allison was actually being very careful with this. One surgeon recommended a full body lift, but she didn't go for it because it was too invasive for her. Two other surgeons recommended something called a medical thigh lift, but they specifically warned her about the risks: vaginal widening and labial stretching. She rejected the procedure due to that. Then in 2005, she met Dr. Ferdinand Affedile, a New York plastic surgeon. According to Allison, Dr. Affedile told her he would perform a lateral thigh lift, making incisions on the outside of her thighs, which would not cause the vaginal problems she was warned about. So that sounded about right. She thought she found the right surgeon. Well, things went wrong. On March 2nd of 2005, Allison went in for surgery. When she woke up, she discovered incisions along her groin and on the inside of her thighs, not on the outside where Dr. Affedile had marked before surgery. He had actually performed a medial thigh lift, the exact procedure Allison had specifically rejected because of risks. And then things got worse. Just over a week after surgery, Allison was hospitalized for 11 days. The surgical wounds had broken down completely. They opened up, started bleeding profusely, and developed a severe infection. As the wounds broke down, the skin around her vagina was pulled toward the wounds. Her external labia became tethered and flattened, appearing flush with her thighs. The court documents describe her vagina was now permanently deformed and disfigured, complete distortion of both her labia majora and labia minora. Her gynecologist testified that this was not a normal vagina anymore. And the worst part, there's no corrective surgery for this. One doctor just told her to move on and there's nothing she could do in her life. Another mentioned an experimental procedure, but admitted it would probably not work. At 40 years old, Allison had to accept that she would live with this deformity for the rest of her life. April Brown. No hands, no feet, and no butt cheeks. Wanting to fix something that's bothered you since you were a kid is totally normal. But imagine that decision costing you your hands, your feet, and your quality of life. That's the strange case of April Brown, and it's about as horrific as it gets. Back in 2004, she was a successful hairstylist in Los Angeles, owned a salon, and was raising 2 daughters. Life was good. But she had been teased about having a flat butt since childhood, and it got her into a certain mindset to get herself a butt lift injection whenever the money sat right. Then one day while working on a client's hair, that client casually mentioned she did silicone injections on one side, cheap, quick, and she could give April the shape she'd always wanted. It was the case of a right offer that found her money ready. A week later, April found herself lying in a bedroom at this woman's house getting her first injection into her butt cheeks. She was to get 4 injections in total. After the second treatment though, something told her to stop, call it common sense or whatever, so she never went back for more injections. But the damage was already done. By early 2006, April noticed her buttocks were getting hard. Then came the itching, feverish, constant scratching that provided no relief. She googled silicone butt injections and found horror stories from other women whose bodies were deformed by lumps of silicone. Her buttocks started to discolor and harden. The pain became excruciating. At one point, she woke up scratching and pulling her own skin off. For years, she went from doctor to doctor trying to get help. In February of 2011, a surgeon operated to try to remove the material. The surgery was unsuccessful and left April with a hole in her buttocks. Then in June of 2010, everything went catastrophically wrong. April developed a staph infection that doctors said was connected to the silicone injections. Her body started shutting down. Her limbs began curling and turning black. She lay in the hospital bed looking down at her hands and feet, realizing she was going to lose them. But doctors weren't giving up just yet. They put her in an induced coma for 2 months. They did this to save her life. They performed 27 surgeries. The medication used to stabilize her blood pressure and keep her organs alive had starved her extremities of blood. There was no choice. In August of 2011, doctors amputated her hands, her feet, and the flesh around her buttocks and hips. Only a 1-inch thick layer of skin and tissue remained where her butt used to be. When doctors tested what had actually been injected into her body, they discovered it wasn't medical grade silicone at all. It was bathroom caulk. The industrial grade silicone you'd normally buy at a home improvement store. Dark abyss. Maria Peñalosa Cabrera left brain dead. In Latin America, plastic surgery is practically woven into the culture, and for some Latin American women, enhancing your appearance is seen as a rather easy investment in yourself. But part of this cultural acceptance has a darker side. When procedures are expensive and you're living abroad, the temptation to cut corners can be fatal. Maria Peñalosa Cabrera knew this risk. The 31-year-old Colombian mother of 2 was living in Queens, New York, selling tamales and empanadas in her neighborhood during summer months while dreaming of becoming a beautician. She had silicone butt implants that were causing her pain and she wanted them removed. The problem was that a legitimate removal procedure is expensive, so when a friend recommended someone who could do it cheaper, Maria listened. On March 28th of 2025, Maria arrived at an Astoria apartment at 1 p.m., accompanied by a friend who waited in the living room. She went into an adjacent room where Felipe Hoyos Foronda, a 38-year-old man with no medical license in the United States, had set up a makeshift medical office. There was an exam table, cosmetic injectable syringes, exam lights, a metal IV stand, and shelves lined with injectables. He had been running this operation from his home, advertising himself on TikTok showing before and after pictures of his patients. The procedure costed $1,900. Foronda later told police he had performed this procedure, quote, hundreds of times from his apartment. This time would be different. He injected Maria with lidocaine and saline. Lidocaine is a local anesthetic. When administered properly by medical professionals, it's safe, but in excessive amounts, it causes lidocaine toxicity, which then manifests as seizures, irregular heart rhythm, respiratory failure, and even cardiac arrest. Maria became lightheaded. Then her speech started slurring, and then she stopped talking altogether. Hoyos Foronda administered an IV, tried CPR, and called for emergency services, but by the time the paramedics arrived, Maria was unconscious in the medical chair. He panicked, and while the woman was being rushed to the hospital, he got in his car and drove straight to the JFK airport. Port Authority police found him at Terminal 5 standing at the Starbucks line moments before his flight was set to depart. When they searched his car at the airport, they found syringes, empty bottles of lidocaine, and empty bottles of human growth hormone. Meanwhile, Maria was at Mount Sinai, Queens. Doctors spent over 2 hours trying to revive her after she was intubated. She showed no signs of brain activity. She died, leaving behind 2 sons, ages 3 and 1. Hoyos Foronda is now being held without bail and faces up to 15 years in prison. Liu died from 6 procedures in 1 day. We've seen how greed and negligence can destroy lives, but sometimes that happens even when the clinic is fully licensed and the doctors are legally certified. People can still just make mistakes. On December 9th of 2020, a woman from rural Guizhang in southern China's Guangxi province walked into a cosmetic surgery in Nanning. She wanted a complete transformation. The clinic was happy to oblige, for a price of course. Liu took out a loan of more than 40,000 won, that's about $5,600, to finance not 1, not 2, but 6 procedures. Yes, all in the span of 24 hours. And you're probably asking yourself, why would they even let that happen, right? Well, you already know the answer. Money. It's the answer to almost every question. Money. That afternoon, Liu underwent her first surgeries, double eyelid surgery and a nose job. That alone took 5 hours. Most people would rest after that kind of ordeal, but not Liu. Next came liposuction on her thighs. Then the following morning, while her body was still recovering from everything she had been through, the fat removed from her thighs was injected into her face and breasts. Another 5 hours of surgery. On December 11th, Liu was discharged. She was walking towards the elevator but never made it there. She suddenly collapsed on the floor, and after initial emergency efforts by clinic staff, she was transferred to the second Nanning People's Hospital. She was declared dead later that afternoon. The autopsy report showed that she died from acute respiratory failure due to pulmonary embolism after liposuction. Basically, a blood clot that had formed during the liposuction traveled to her lungs and killed her. She left behind a husband, an 8-year-old daughter, and a 4-year-old son. Liu wanted a dramatic transformation that never was, and after 6 surgeries that should not have happened under doctors' recommendations under 24 hours, she sadly passed away. Demi Agaglia, fat mistakenly injected into bloodstream. The day after surgery, this woman sent her mom a text saying she had gotten the body she always wanted. 24 hours later, her partner sent a different message, just 2 words, she's gone. Demi Agaglia, a 26-year-old mother of 3 from Salford, England, traveled to Turkey in January of 2024 for a Brazilian butt lift, also known as a BBL. She had seen celebrity endorsements on social media for a company called Comfort Zone Surgery based in Istanbul. The procedure promised to give her the body she had always wanted by taking fat from somewhere else on her body and injecting it into her hips and buttocks. Her mother tried to stop her. She told Demi she was a good-looking girl and didn't need the operation. Her partner didn't want her to have the surgery either, but there was no changing her mind. She had already booked the trips months earlier. On January 4th of 2024, Demi traveled to Turkey with her boyfriend. They stayed in a shared villa in Istanbul before being taken by taxi to the hospital for the procedure. The surgery happened, and when Demi woke up, something was immediately wrong. Her boyfriend noticed she was shaking and appeared very cold. The next day, Demi complained of a tight chest. Staff from Comfort Zone were called to the villa. They checked her blood pressure but did not inspect the surgical area and failed to also check her heart rate as well as her pulse. Then they did something that a Harley Street plastic surgeon would later describe at the inquest as completely bizarre. They tried to feed her pieces of cucumber. It later emerged that these staff members weren't even qualified nurses. And of course, the cucumber didn't work. I don't know why they were trying to feed her cucumber like it's this life-saving vegetable. I mean, it's healthy for you. It's 96% water. Yeah, it's healthy for you, but what does that have to do with anything? But yeah, like I said, the cucumber didn't work, so Demi ended up collapsing. She was rushed back to Evrasia Hospital where the surgeon told Bradley they had done everything they could. 3 days after the operation, she died. The cause was microscopic fat embolism. Turns out that during the procedure, fat had been injected directly into her bloodstream. It traveled through her body, reached her lungs, got stuck, and killed her. Megan Espinoza. Doctor left mid-procedure to negotiate more sales. At the very bottom of this iceberg sits something so bizarre, so incomprehensibly cruel, it barely feels real that a so-called doctor could do this. The woman in the story is Megan Espinoza. She was a 36-year-old kindergarten teacher, a mother of 2, living in San Diego. On December 19th of 2018, she went to the Divino Plastic Surgery of Bonita, California, for what should have been a common breast augmentation. The surgeon was Dr. Carlos Chacon, who had been practicing for over a decade. Right from the start, Chacon was cutting corners. He had an untrained nurse administering anesthesia, someone who had no business doing that job. Megan was under conscious sedation, and about 2 hours into the surgery, her heart rate spiked. Then it stopped. She went into cardiac arrest. At 2:22 p.m., Chacon started CPR. He managed to get her pulse back, but Megan did not regain consciousness and wasn't able to breathe on her own. A nurse continued squeezing a bag valve mask to get air into her lungs. This is when any reasonable person would call 911, right? Well, Chacon didn't do that. Instead, he called other doctors for advice. One of them told him to call the paramedics because Megan needed to be intubated. Chacon refused to make that call. Instead, while Megan lay in the operating room, unable to breathe on her own, making gurgling noises and exhibiting seizure-like activity, Chacon left the room multiple times to see 4 other patients. He was conducting consultations, selling more procedures. When Megan's husband called to check on her, Chacon told the staff to lie about her condition. He prevented anyone from calling 911. At 5:24 p.m., that's 3 hours after Megan went into cardiac arrest, Chacon finally called. But he actually lied again about her condition. Paramedics arrived and were horrified about what they found. Megan was transferred to a hospital, intubated, and placed in the ICU. Unfortunately, she never woke up. She simply never regained the ability to breathe on her own. 6 weeks later, she died. Chacon was arrested with second-degree murder, sentenced with only 3 years in prison, and his medical license was suspended for life. Before being taken into custody, he turned to Megan's father and said if he could trade places with her, he would. But the fact was, he couldn't. Because for 3 hours while Megan suffocated, he had bizarrely been too busy making sales. Alright guys, that's going to be it for this video. If you enjoyed the final installment of the November Iceberg series, please leave a like and leave a comment, engage with the video. Subscribe if you haven't already. Before Present Me is going to make a speech, I do want to just acknowledge the fact that I think every single story we went through in today's video was about a woman getting cosmetic surgery. We don't really hear about men getting cosmetic surgeries. It's just the beauty standards, and I just want to make it clear that if you're a woman watching this that's considering getting cosmetic surgery, if you know of anyone, your mom, your sister, your wife, just make sure they do their research, or you could do the research for them. Just make sure you go to a trusted location, and at the end of the day, remember, you don't need the cosmetic surgery. What matters is literally corny statement. It's literally your heart. So you don't have to get that cosmetic surgery. You know, you don't need big tits to survive in this world. Okay, like I want to make that clear. You don't need a fat ass to be beautiful. That shouldn't be the standard, but it sadly is. But if you do want a fat ass, then make sure you go to a proper location and do your research. Obviously, mistakes can always happen. Just wanted to get that out of the way. And now let's see what Present Me has to say. Thank you guys for the support so much on Iceberg Month. Coincidentally, while this whole half of the month was going on, I was horribly sick, literally almost bedridden. I went to Mississippi for the animatronics video that will be out on December 3rd, and which will be the next video, and came back horribly sick. Literally, that's why I couldn't stream. I can't do anything. You can still hear that I'm nasally. I'm getting over the sickness. But with that being said, thank you guys so much for the support. I've seen you guys pop out. I've seen a lot of people comment like, I haven't visited this channel in so long. Bruh, you know I make more content than icebergs. But whatever. As long as I brought y'all back and show y'all I'm still here. that was the goal. And also the goal was just to have fun. To get on YouTube, and it brought back that flame under my ass that I really wanted about YouTube and main channel specifically, because if you know, I've been grinding heavily on streaming. That's been my thing. But I can't leave my baby behind. You know, this channel, this is my baby, and so I'm finally putting so much effort. I have so many videos planned. Just want to give a big thank you to you guys for the support, and just know, main channel, I love you. I love you, main channel. And that doesn't mean I'm leaving Tuvington alone. Tuvington is still, I'm grinding on both. I just coincidentally got sick. This is supposed to be my streaming month because I had all these videos planned out. Either way, if you're wondering what videos we have next, we have the dark truth of the animatronics industry. Then we have one creepypasta from every state. And then we have some other videos with 3D modeling. So, stay tuned for that. Alright, with that being said, I will see you guys next time I upload.